The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
I'm Dr. Rudy Kachmann. Welcome to the show. This is going to be very interesting today. You know, a lot of my shows are about wellness, things you can do to prevent most of your illnesses. We can prevent about 70–80% of what occurs to us. Isn't that a wonderful opportunity? And today, this is a very interesting subject because I think it's underdiagnosed, it's undertreated, and I hope when you leave the show that you will understand what I'm speaking about. It's about the gluten, okay, in our life. Gluten is a protein, okay? It's a protein. If you were to extract it from gluten foods, say like bread, it is the dough and the fiber. Frankly, you could roll it up and throw it like a tennis ball, okay? And through evolutionary times, you know, in the beginning, we were more meat eaters than plant eaters. And about 10,000 years ago, we started having farms and growing our crops. It's only been about 10,000 years. And in terms of time, 12,000 years in evolutionary time, that's very little. So our bodies have not become adjusted to the gluten in the grains, the rye, the barley, and the wheat, which are the main glutens. Our bodies are not used to them. It's different in different cultures. Farming started more in the Middle East, for example, and they're through genetic testing, have been more used to eating a lot of gluten. And so their blood work looks a bit different than us. Like in Australia, in Europe, they run tests for gluten very commonly. Yeah, like in Australia, 95% of the people going to see a doctor have had gluten tests done. Mm-hmm. While in this country, maybe 5%. Yes. And the interesting thing is, what sort of problems do gluten cause? The main one we're concerned about is celiac disease. 1% of the population, 1%, have celiac disease, and that's a very serious illness, and the symptoms of which are very diffuse and very complex. It was been diagnosed maybe 75 years ago, and invariably those patients were wasted away. They were understatured, they were shortened, they had osteoporosis, they had terrible diarrhea, vomiting all the time, bloating. That was a typical celiac patient in those days, but that has changed a great deal, partly also because the gluten we're getting, the grains that we have changed tremendously. Wheat used to be 12 feet tall, 12 feet tall. Then in the 40s, the Rockefeller Institute in Mexico, they used that, and a doctor came from University of Minnesota, and he genetically modified the wheat so it was 12 feet tall. Now it became about 2 or 3 feet tall. Yeah. And it became a straight plant instead of that 12-foot plant that would, because of the gluten and the weight of the wheat would literally fall down. You know, years ago, Now it's called triticale, and we have Emma. It was called Einhorn, I think, beginning. That depends on the number of genes that it has. It's been tremendously changed. And when they discovered that in the 40s, we were able to increase the amount of food in the world 10 times. It saved a lot of lives, but they did not test it in humans. It was not tested in humans. And kind of find out, actually, it is our bodies are not reacting very well to it. So we have celiac disease, 1%. Not every celiac patient has symptoms. So a lot of the symptoms of celiac disease, which are not just abdominal, diarrhea and bloating and diabetes, a lot of them are systemic. No abdominal symptoms whatsoever. What symptoms can gluten cause? About 150. Yeah, it's that complex. Yeah, it could be Parkinson's disease, could be multiple sclerosis, thyroid disease, many skin illnesses, dementia, schizophrenia, type 1 diabetes, type 2 diabetes, all sorts of symptoms, and people aren't running gluten tests, so they're misdiagnosed. Cardiomyopathy, where the heart just dilates up, can be related to gluten. For example, I met with somebody from Trine University the other day, and I happened to have these books preparing for this lecture laying on my desk. She saw them, and she said, "I'm interested in that." And I said, "What?" She said, "I'm getting ready for a show." What she said, she had taken her 4 or 5-year-old son to a rheumatologist in Indianapolis, and this pediatric rheumatologist said, well, you know, because he had rheumatoid arthritis at age 4 or 5, yeah, and that's serious. Juvenile rheumatoid arthritis is a very serious and crippling disease. She says, well, you can try gluten elimination, and left it at that. I thought that was a mistake. Dr. should have said, let's do some gluten testing. So let's review the testing a little bit, yeah. It should have been tested because that child, if that's what it is, I didn't say that's what it was, what it may be, one of the symptoms of gluten problems can be rheumatoid arthritis. Yes, indeed it can. So about 1% have celiac disease, okay, and about 10%, 12% or so have gluten sensitivity, where they can eat gluten sometimes, other times not. Certain foods they can't eat, for example, and so the reaction is intermittent. The average time it takes to diagnose in the United States somebody with a gluten problem, 10 to 11 years, average time, versus Europe, Australia, they may diagnose it immediately. So the many lost opportunities, and many of the effects of it, like rheumatoid arthritis. So that doctor should have said, let's run some gluten tests on you. So what are the tests you can run? Okay, let's go through these. Now, we can do genetic testing, change your genes, okay? It's a highly genetic disease. If a mother and father, for example, have abnormal gluten antibodies in their blood, for example, the odds of a child or grandchild developing is pretty high, 60, 70%. So it's good to know who in the family has a problem with gluten. Many of the celiacs are very, very short children. Infertility is also one of the symptoms, which sort of reminds me, I had someone working for us, and she's telling me that her daughter was unable to have children, and I was just that time, I think, doing another show on gluten, and I said, well, why don't you run a gluten test? And this mother, unable to have children, had a gluten test that was positive. She went gluten-free. Guess what? Get 3 kids now. That's a true story. Yeah, it was a lady did housework for me when my mother lived with us, and we just needed help from a maid. Yeah, it's a true story. And so it is a cause of infertility. So a woman having a problem, a family having a problem like this, should get gluten testing. It sure worked out well for this beautiful family with a beautiful children now. So the blood test can be genetic testing, so it's in your genes. Remember we spoke about that? It's the GD2, GD8 genes, and this has been pretty worked out. You can get the genetic testing a couple of ways. You can actually get it through saliva. You can go to the drugstore, pick up a tube, some saliva goes in there. About a week you get the test results back, and it tells you the odds of you or the antibodies that you have, the odds of you developing celiac disease or gluten sensitivity. If all those tests are negative, then the odds of you having this illness is very low, not zero, but extremely low. They can also check the blood, do gliadin test, and find out what antibodies that you have developed. So I think that's important. And also you can do a gluten challenge, and if you do a blood test, you can't have been gluten-free on purpose, say for a few months. The blood work won't do any good. You have to take it for a few months to get the test done. So the results can be, you may need multiple tests. You can do a gluten challenge also and collect some feces, and that's very accurate. And another way is to go to a gastroenterologist, and they can put a tube in you and look at the villi where you absorbed the gluten, and look at them and do a biopsy. But the trouble is that, they biopsy 2 or 3 places. They're not biopsying. It's mainly the small intestine where gluten is absorbed. And we have, while we're on that subject, let me explain that a little bit. We have villi, okay? If you were to spread out your intestine, your small intestines, 22 feet, were to spread it out totally, and the villi, are kind of up and down like this, so that they can have a lot of absorptive surface, lined up one after the other, 1 cell layer thick, 1 cell layer, 1 cell layer. You can imagine, and you talk about the skin that's external to your body. Well, the gut is part of your skin, really, but it's only 1 cell layer thick. Your skin here is 5 or 6 cells thick. Well, that's just 1 layer, so you can see how easy, and that's what celiac disease and celiac sensitivity is all about. 1 cell layer thick. And there's an enzyme called zonulin, okay, that helps protect this lining. But if you take foreign substances like gluten, it can punch holes into your gut, into these villi, and over time, your antibody reaction to substances that you're eating and the gluten proteins getting into the blood, your blood reacts to it like it's an invader, and it will thin your alveoli. You can look at them, do a biopsy, look at them, and see that they've worn away. So they even have, it's called the Wallace grading system, I think it was 1 to 5, the thickness of your villi. So that you can do a biopsy, look at the villi under a microscope, how thick are they, how many holes are there, for example, because the disease is caused by punching holes in your gut, in your body, your blood, your Army, Navy, Air Force that defends you, reacting to the things that you're eating. That's what causes celiac disease, and the 150 symptoms that could happen from eating barley, rye, and wheat. Yeah. See, remember, through evolution, we have not adapted to these foreign invaders. We did not eat them 100,000 years ago, and remember, they've changed. The Rockefeller Institute, for example, they changed the genetic component of wheat. So we fed the whole world with untested wheat, and they're having a problem now. We may have saved their lives originally, but now they're having problems. So we have genetic testing, blood testing for antibodies, a rectal challenge, for example. Some people may need a combination to make a final diagnosis. They'll call the gold standard the endoscopy with the biopsy. The only trouble is, they act like it's 1% risk. I think it's a little higher than that because I myself, neurosurgeon I've seen 2 patients who ended up with a colostomy because they punched a hole in their gut. Remember, it's a little bit thinned because of disease. So when they do genetic and antibody testing in the blood, the rectal channels, or the mucosa, those are riskless tests essentially. Having an endoscopy done has some risk, but it's low. But personally, and the author of some of these books which I have here have clearly stated they expect the genetic and DNA and the antibody testing to eliminate, in essence, the direct need for endoscopy. I myself, we're supposed to get a colonoscopy and endoscopy every 5 years or so, and I saw a company has formed that I sent my stool in 2 weeks. I get a report collecting some feces, for example. They're doing the genetic testing, DNA testing for tumors of the colon, for example. Did I say that's the only method? No. Is the best method? Not for all cases by a long shot, but you can see it's clearly heading in that direction. So you have to be open-minded, get informed, participate in your health care. So what other symptoms could a person have that we spoke about in diseases you can develop from gluten? Autoimmune disease. Autoimmune means that you yourself cause it, and there's no specific agent except a reaction of your Army, Navy, and Air Force. It can be white spots, alopecia, arthritis, autoimmune thyroid disease, cirrhosis, Crohn's disease. Diabetes is high on the list of autoimmune diseases caused by gluten. Yeah, remember, 1 out of 2 people in this nation is pre-diabetic or diabetic. I saw one I was counseling today for free at the Tri-State, at the Three River Pharmacy near Concordia High School. I counsel people there for free if they have diabetes, incidentally. And after taking the history from him, I wonder if really he had a gluten problem based on his past history. Fibromyalgia, hypothyroidism, thrombocythemia is one, multiple sclerosis, optic neuritis, canker sores. That's interesting. There is a little bit, there's one person in my family that definitely has a problem with gluten. You kind of wonder. We have one person who has leukemia, which can be associated with gluten, and probably needs some genetic testing done. The one who has a leukemia, I even went to see the cancer specialist to ask him to run a gluten screening test, and personally went there, told him that I spoke to that cancer patient recently, the leukemia patient. They never did it. They never read these books. Uninformed. Typical in the United States. So you must participate in your health care. Next time I see that cancer patient, I'm going to bring it up again, to bring it up to their doctors, because one of her grandchildren clearly has celiac disease. Could she have a gluten sensitivity herself, the lady with the leukemia? Yeah, sure said could. Sure said could. I did my best. Migraine headaches, sarcoidosis, oral cancers, we already mentioned that. And I have some of those. My son has some of those. We always thought it's stress, but it makes you wonder, maybe we have gluten sensitivity. I don't know. I don't have any of the health problems, thank you. And probably not, but maybe they're stress related, but who knows? Let me read you a little bit of a comprehensive list of gluten-associated medical conditions. These are out of a book I'd like you to read sometime called Dangerous Grains, okay? Because you have to participate in your health care, and you're going to have to do some reading. This is a complex problem. A lot of times your medical provider or doctor, the authors are James Braley and Ron Hogan, and I've read this 2 or 3 times, this is a complex problem. Just a little talk, even for an hour, will not fully inform you. You must do some reading, especially if you're suspicious, like you get type 2 diabetes, or you get rashes, or MS, or all kind of arthritic conditions. Have a look at this. And but let me just read you a few of the symptoms. It'd take me a half hour to read them to you all. Remember I said 150, okay? But abdominal distension, recurrent abortions. Remember I talked about fertility? Yeah. Autoimmune reactions, Addison's disease, AIDS, and alkaline phosphatases are elevated. We talked about the white spots, alopecia, amenorrhea, no menstruation, anemia, myasthenia gravis, weak muscles, neuropathy, liver disease, bone diseases I could give you a list of 15, hypocalcemia and hypoparathyroidism, thyroid disease. Many cancers associated with the gluten problem. Yeah, many cancers. Breast cancer, prostate cancer, brain cancers, lymphomas are listed here again, celiac disease, cardiomyopathy, dilating weak heart, for example, cerebellar ataxia, we become very unsteady. I saw that in my practice. Remember, I was a neurologist and neurosurgeon. I saw a number of these patients, and I picked this up because I was familiar with this. I've read these books 10 years ago, so I'm very familiar with the subject. Strokes, epilepsy, headaches, calcifications all over the brain, as typical of a gluten problem. Chest pain, as we would expect. And Down syndrome, for example, where a child is born with a problem, with a neurologic severe problem. Could be gluten problems in the mother or the father. Depression. Gluten problems are commonly seen in people with moderate severe depression. Mm-hmm. So, in abdominal symptoms, of course, we talked about bloating and flatulence and ulcers, and we can go, this is just page after page of symptoms. Dermatitis, herpetiformis, the severe rashes you can get on your body are commonly caused by a gluten problem. And remember we mentioned you can have celiac disease, that's 1%, but gluten sensitivity, where you are sensitive to glutens, but not every gluten. For example, it can be eliminated by following a gluten-free way of eating. Incidentally, then now more gluten-free foods available than ones you should not be eating. Remember, and they're labeling things better. Okay, the problem before was a lot of this barley and rye and wheat were in other foods. Now it's fairly well labeled, but you can't trust it. The problem is if you have celiac disease, you can't even take in 1 molecule of the gluten. one. That's how careful you have to be. Yeah. It's not that it adds up anything. Just 1 or 2 a very small amount, and you can Incidentally, if you eat gluten-free, and if indeed you have a problem, you know how long it takes for you to start feeling better? 2 or 3 days. Yeah, our cell lining is replaced. Isn't that good news? Every 2 or 3 days. About 3 days, there's one cell layer thick of cells throughout your 22 feet of gut, the tennis court size gut that we have. 3 days, brand new gut. So if you eat the correct way, things will appear just in a few days. I mean, that's wonderful news. It doesn't take years or months, and people can develop a lot of vitamin deficiency, the gluten problem, because they're not absorbing the nutrients that are absorbed in the small intestines because of holes in the gut, and they can be vitamin A deficiency, vitamin B6 deficiency, vitamin B12 deficiency, vitamin D, E, K. I mean, can you imagine all that? And a failure to thrive, weight loss can all be due to gluten problems. And a lot of cancers can be avoided too. Schizophrenia is even associated with gluten problems. So I think the most important thing is to you yourself and for you and your doctor to be suspicious and to run the necessary test, and maybe sometimes repeated test. And remember, just a biopsy is just a certain section of the bowel. It's not every villi there, and things may change. So sometimes if symptoms persist and you were told, well, you don't have gluten sensitivity or celiac disease, things can change. And the problem can begin at any age. You can be born with it. The child doesn't thrive at all. Child can be born with it, okay? Mother, father may have had it. No one was suspicious. But it can be set off by stress, for example, sudden change, loss of job, for example, stressful, a divorce, for example, and you can set off new symptoms. But it's not, you know, if it was a bacteria, viruses, you're probably over with it 2 or 3 days or a week, okay? But remember, if you have persistent problems that are not explained, then it becomes more important to do some screening, for example. I mean, there are foods that are safer than others. And you need to, the best way, I think, to get a long list of foods that you can or cannot eat is to look at some of these books. Living Gluten-Free for Dummies by Dana Corn is an excellent book to read. And if you have this problem or suspicious of the problem, you need to do that. You need to do some reading here. This is not just not participating in your health care, because most providers don't run these tests. You may go to one that does. And most of the neurologic diseases, like in my group, many neurologists, many neurosurgeons, and almost any of those neurologic diseases should have a gluten test. Yeah, I remember meeting a neurologist that joined our group while I was working out at one of the workout places, Planet Fitness, I think, someplace. She said she had just finished her training, and she had been told as a neurologist, every neurologic patient they saw, unless it's obvious brain hemorrhage or something, she would run a gluten test. Every one of them. I applaud her. I applaud her. That's what needs to be done. But it's not done by most neurologists by a long shot. Everyone that they got MS or have had a stroke or tension, ischemic attack, or whatever, she runs the gluten test, and I take my hand off to her. Here's another one, The Gluten Connection, a very good book to read here. Like I said, you need to do some research here. And it reviews a way of eating, for example, what are gluten-free foods, you know, which corn, rice, for example, will be gluten-free. Beer, you can't drink beer if you get a gluten problem. But regular alcohol, I didn't say you should drink, but if you did, generally, but check, see what's in the alcohol you're drinking. Is this gluten-free? Because they may have included some wheat products. You never know. And some of the antibiotics, they have names to them. The antibodies, they have names to them. An IgA antibody, AGA antibody, ATTA, and it mentions, which I think is important too, blood tests are inadequate to detect gluten sensitivity. Remember the 12% are gluten sensitive? Because they're intermittent. You don't react to everything, and the laboratory test may be incomplete. Maybe so their endoscopy and a biopsy may be of some help, maybe not. A negative test wouldn't prove you don't have gluten sensitivity. So it's many symptoms, repeated testing, and you may come up with gluten sensitivity. And sometimes, if you have unexplained symptoms and they're serious enough, just go gluten-free. Read one of these books so you know what to eat. There are recipes in here. Just go gluten-free for 2 or 3 months. Maybe even a month would do it, okay? Remember I said the changes in the gut occur in 3 days. So maybe even for a month. And see, oh, I feel great. I'm stronger. I'm walking better. I'm more steady. My chest pains, my migraine headaches, my upset stomach went away. Well, you may have a gluten problem. You may have gluten sensitivity. It comes and goes, and your blood test, genetic testing, stool testing, saliva testing are not totally confirmatory. So it may take repeated testing to prove the point. Sometimes no test will prove it. You just know being gluten-free seems to solve your problem. So that's, what we do. Some people, I think anyone, of course, who has bowel symptoms, irritable bowel, colitis, Crohn's disease, they all should be gluten tested. I mean, you may assume this, you may assume that, but inflammatory bowel disease, they all can have a gluten problem. They all need to be tested. Like neurologically, if you have multiple sclerosis, you definitely should be tested. I hardly ever meet a patient with multiple sclerosis who have been tested for gluten sensitivity or celiac disease. Remember, celiac disease is not just about the bowel. 50% of the people, their symptoms are not in the bowel. They're in the heart or neurologic symptoms, or their on their skin, for example. And some people are just sensitive to food too. They're food intolerance. So there is a staircase, to food sensitivity. Some people are just sensitive to certain things. They're not allergic, they're sensitive. Then other people's are allergic, like to peanuts, for example. They can't have any. Okay? Then we go up the line to gluten sensitivity, and then eventually to celiac disease. So there is a staircase where it can be partial to light to severe, and the antibody production will be different, about different situations. And so don't be fooled into thinking you are cured if you go off gluten for a time and your symptoms go away. And this may be a gluten problem and maybe not. You have to be open-minded about these things. So we can be intolerant to food, sensitive to food. We maybe have holes in our gut with advanced disease. The Native Americans years ago used to eat C4 corn. It came from Mexico, and wheat, you know, that grew 12 or 13 feet high, which we introduced to them. And then we moved a lot of them into Arizona, into encampments, and we started feeding them American wheat, for example, and they were devastated by high rates of diabetes, high rates of gluten problems. Yeah, we did it. We selected the food instead of what they ate in ancient times, which was C4 corn, much healthier. And then we genetically modified the corn. If you go to Iowa today, the whole state, you would eat any of that corn, you get sick. They feed it to cows to fatten them up so you can eat a steak. When you're eating steaks today, what are you eating? Corn. You're eating corn. You're eating genetically modified corn. Hate to tell you, you go to some restaurants today, what are you eating? Genetically modified corn when you order salmon from a pond. I know a country club here where the salmon is from Scotland. So I pinned the chef down about it. It's not from Scotland. It's from a fish pond where the fish are fed corn. You're eating corn. Remember, you got to find out what did that animal eat that you're eating. You're eating what that animal ate. Yeah. If they eat genetically modified wheat or corn, that's what you're eating. Okay? Interesting point, isn't it? And you'll pick up the illnesses that associate with that. You want to eat the salmon from the ocean that was eating good grasses, sardines, a much healthier food, for example. And the changes in where you're more likely to find, and you should read the labels, okay? And you'll find wheat, barley, and rye. Remember we spoke about that, the main offenders, wheat, barley, and rye. If you eat them purely, well, you can identify them. You don't eat them, but you find it a certain amount. You can't eat that if you get a gluten problem. Barbecue sauce, breaded fish, chicken, or shrimp, yeah. Potato bread, some soups, cereals, cookies, cakes. But now you can buy gluten-free cookies. The darn trouble is a lot of the cookies get sugar in them too, get fat in them, and a lot of people who are eating a gluten-free diet have weight problems and developing diabetes from their weight problems instead of their gluten, okay? Potato chips, frozen dinners, pastas, rice mixes, sauces, some ice creams, teriyaki sauce. So, but now those are starting, you've got to read the labels and ask them, is this gluten-free? Okay? So what should we be eating, for example? You got to read the labels. If you're following a gluten-free diet, the soups that you have to be sure they're gluten-free. And remember I said, if there's even one molecule of gluten in what you're eating and you get celiac disease, it's a problem. And I have a teenage relative who has this problem, and it's serious for her because she, as much as we stress and I give her books, I don't think she's reading them. I'll catch her eating things that have gluten in them. It's not going to work. If you get celiac disease, 100%, yeah, 100%. If you get gluten sensitivity, you can get away with some exceptions, but you got to know what they are. You can't be drinking beer because that has gluten in it, for example. You might get away with vodka, for example. You may or may not. I didn't suggest to drink it, okay? But you have to read the labels or check with the bartender. Be sure, because especially if you have a true allergy like peanuts, for example, you could die from that. And so you need to know what it does to you. And symptoms, sometimes people develop hives or asthmatic attack or difficulty breathing. This could be leading to more serious problems, and this would be called food intolerance and allergy. And you have food immunity reactivity, FIR. That may not be gluten disease. It could be a true allergy to food. So it can really get, confusing. And another one that can be seen with the psoriasis, a horrible rash, the elbows, not horrible in some people, but it's always there on the knees or on the elbows, behind the head, for example, and it can be pretty nasty. Could be a gluten problem. Isn't that nice news, though? You go gluten-free, and the darn thing goes away without medication. Isn't that wonderful? Eczema, acne rosacea, whether all over your body, hives can be caused by it. Neurologic disorders, let's review those a little bit. Ataxia, unsteadiness. I've seen that in my practice because I'm a neurologist, neurosurgeon. I see some people look like they're dancing when they're walking. Can be caused by gluten. And boy, that's a difficult thing. You have to be empathetic with the patients who have this. And when the gluten-free diet and the ataxia totally cleared up in a week. In a week, I saw it. In a week. So gluten awareness is important, but I think you might need to lead the way, because I don't think that the most practitioners today will not lead the way on the gluten thing. And excuse me, a little bit of maybe some gluten odors in the air, huh? No, I'm not sensitive to it. And so severe headaches, migraines can occur from this. And a migraine headache, is a trouble headache. I saw the patient I spoke about earlier, I saw today, had type 2 diabetes, also had migraines. I ordered a gluten test as well as glucose tolerance test, check for a serum insulin to see if you get diabetes. And but his migraines too, even at age 62. Could this be a gluten problem? Yeah. Remember what I said? You can have celiac disease all your life, and it's never diagnosed and not many symptoms. Okay? Well, so suspicion is important. Autism is related to it. Autism too should have screening. And his book is talking about a 9-year-old boy, 9 years of non-communication, wasn't talking, and autistic. He was diagnosed at age 3 being autistic, and then eventually they checked him for gluten, and the whole thing cleared up. Wow. See, what a wonderful thing. What a wonderful thing. Behavioral problems, ADHD, you hear about those a lot today. Especially in children. I saw an adult with it recently. Yeah, no question. She saw me at McDonald's getting a cup of coffee. Okay, and she knew me through something, and I decided really. I wonder if she was misdiagnosed all these years having a gluten problem, and she had ADHD, bipolar. Don't you wonder? Never been checked for gluten. I encouraged her and wrote it out for her. And the big one is lupus. Yeah, lupus, which can cause all sorts of symptoms, rashes and tongue problems and liver problems and recurrent neurologic symptoms. And there's a doctor in Australia that Dr. Lustig visited, and Robert Lustig, a pediatric endocrinologist in California, he visited and went to Australia, and he went to see a doctor, and the doctor had all sorts of pictures on the wall of patients who had had lupus at one time, but because he saw them from all over Australia, and he checked them all for gluten problems, and they all got well. Who in the heck, what neurologist has 100 pictures of lupus patients on the wall that he cured? Nobody in the world. So Dr. Robert Lustig from California became interested in this. He's a pediatric endocrinologist. Excuse me while I drink a little water. And can you imagine even my vocal cords become dry? Well, I spoke for 4 or 5 hours this morning telling people how to get rid of their diabetes for free at the Three Rivers Pharmacy that I can go to. So maybe I'm getting a little bit dry. And again, it points out that neurologic diseases have a lot of gluten intolerance associated with them. So increased risk of women over age 50 who are menopausal. Okay, all right. Being thin or having a small frame brings up the possibility. Drinking too much alcohol can be result in gluten problems. Having a family history of disease. Remember, I told you this is highly genetic. So if you get a bunch of people in your family, or even one person who has celiac disease or gluten sensitivity, you may want to get checked yourself if you have unexplained symptoms, but even if you're symptom-free, because it can, remember I said, it can present at any time. Maybe all of a sudden you have cardiomyopathy or you're ataxic. It would be nice to know what your genetic history is. And a lot of osteoporosis is associated, you know, where your bones thin, because you may develop fractures. Unexplained fracture, could that be a gluten problem? You're done right, it could be a gluten problem. And smoking results, sometimes sets off the diseases. And sometimes certain medications can do it too. And so, especially the so osteomalacia, soft bones, can be associated with gluten intolerance, as well as many arthritic conditions. I'll see somebody who's of normal weight and they were an athlete and they developed severe arthritis all of a sudden at a younger age. They should be tested for glutens too, because remember what I said, rheumatoid arthritis, but advanced osteoarthritis can be caused by a problem with gluten sensitivity or celiac disease. Unexplained back pain, for example. We mentioned rheumatoid arthritis, regular arthritis, and interesting enough, scleroderma, a skin disease, can be caused by gluten problems too. Yeah, kind of interesting. Type 1 and type 2 diabetes can be related to that. In children, for example, your child has type 1 diabetes, get a gluten test. That's a big one, because it's treatable. Maybe not all type 1 diabetics is permanent for life. Some can be reversed. If they have a gluten problem, maybe some of the pancreas is still living, which makes the insulin. Then we have the type 2 diabetics. So with celiac disease, a gluten problem, you can be underweight. That's a classic disease we described years ago. But also, you can be overweight. If you're overweight type 2 diabetic, which is more common, could still be a gluten problem, okay? So no matter what you do, you might not get better. Wouldn't that be great if we discovered eat a nutrient-dense way of eating, we'll teach you to eat a gluten-free way of eating. We just said it takes a lot of education. You need to know in more detail what the foods are, and the cookbooks. Once you get used to it, once you're in the habit of it, it's not impossible. It's not that difficult. There are more gluten-free foods today than ones that have gluten in them. Isn't that good news? Yeah. And but you got to be careful that you feel you're conquering something by being gluten-free and you're eating more than usual because you've been unable to eat in the past. Now you gain 50 pounds, and congratulations, you got type 2 diabetes also. You got to be careful about that. So keep track of your weight. If you're gaining weight back, which you before couldn't gain a pound because you had a gluten problem, now you're gaining 50 pounds and you're developing all kinds of other diseases. So you got to be careful. And remember, both types of diabetes can be associated with diabetes. Thyroid disease is a big one too. If you get diagnosed with thyroid disease, that could be an autoimmune reaction to your thyroid. But what triggered the autoimmune reaction? Maybe it was gluten, okay? Maybe you avoided those foods. Maybe this even get better. Maybe this would even get better. And Graves' disease is hyperthyroidism, but it can also be hypothyroidism. That's Hashimoto's disease, that's hypothyroidism. That's inflammation of the thyroid. The thyroid's working inefficiently. That's more commonly associated with gluten. And so that's interesting. And as we mentioned already, all GI things, whether it's Crohn's disease, irritable bowel disease, colitis, whatever it is in the bowel, check to see if gluten is one of your problems, because remember, the gluten will affect this zonulin enzyme, the one that supposed to keep your villi intact. But then if levels too high, develops holes in the gut, allows not totally digested foreign substances to enter your bloodstream, and your Army, Navy, Air Force, your immune system attacks that with antibodies, and that results in the disease, because those antibodies affect the brain, the thyroid, the heart, the skin, your organs all over. Can cause schizophrenia even, even psychiatric diseases associated with that. So let's, what am I trying to say today? Let's go over this maybe a little more now again, so that you understand what I'm speaking about. What I'm concerned about is that we have this gluten, this foreign protein, full of amino acids. Those are protein, okay? About 8 of those are essential. You got to eat them. The body makes the rest of them, okay? But you got to eat this protein externally, and we are eating. So you can, on this way of eating, you can eat more meat products, but you got to know what of the meat that you're eating, what has it been eating, okay? That you're aware of that, but you want to get your protein from meat. Quinoa, okay, K-E-E-N-O-N-A, I think it is the kings of Chile and Peru thought this plant it comes many different colors, but it's mainly yellow, okay? This would be a good thing to put into your smoothie in the morning, which I had one today. Put it in a Vitamix or Ninja Machine, and kale, spinach, fruit, curcumin, but put in there some quinoa. It is the king of the vegetable proteins. Matter of fact, the kings of Peru and Chile would have a ceremony when they planted it in the spring. And they would use, yes, interesting story, they would use a spade made out of gold and some other metal, make it a little more solid. And yeah, they use it. I read that here. Isn't that very interesting? So let's make quinoa. Let's make this spelled with a Q actually, but pronounced with a K. Quinoa. Okay. Make that your vegetable for the rest of your life. This vegetable protein the rest of your life. Okay. The Japanese will eat a lot of seitan, S-E-I-T-A-N. That's incidentally, that is pure gluten. You don't want to be eating that. Yeah, seitan. The Japanese eat that a lot. But I think let's visualize the picture of the golden spade and the yellow pan, which also comes in other colors, pink and others. But next time you go through a good Whole Foods section of a store, look at it and get familiar with, and make this your friend. Put it in salads. Put it in your smoothie every day. Vegetable, a good place to get your protein, because animal meat, you might have said you want to eat more of a protein diet, but you don't want to get the protein from gluten, okay? But this would be a wonderful habit for you. You can eat some corn and rice and learn this list of foods. And in summary, be aware that 150 different symptoms can cause celiac disease or gluten sensitivity. Mm-hmm. You have something undiagnosed, you can't solve the problem. What caused this problem to begin with? Get a gluten blood test, genetic test, stool test, saliva test. You be the leader, because odds are the way medical care is yet today, rarely will they be the leader. You got to be the leader. You got to read some of these books. Go online, become familiar, and lead the way, like the wonderful person with her child from Trine University. Recently I spoke to, whose child has rheumatoid arthritis. She's going to do something about it. You bet. She took a picture of the names of these books, and she's going to order them, and she's going to read them. And her child will have had these tests. And I told her she's got to be forceful and insistent and get these done, because you'll meet a lot of resistance. I don't know why, but it should be taught at the medical school. I fault the medical school for not making this a major emphasis. I've been down there, talked to them. Major emphasis. We need to run more gluten tests on routine screening. A family doctor, what should he be? Should be a wellness doctor. A pediatrician should be a wellness doctor. They need to lead the way on this, not necessarily the public or just myself, for example. But I appreciate you listening to this. I think I've pounded this home to you pretty much, that you got to participate in your health care. You got to do some reading and be suspicious about symptoms that you're having, or a family member, or your child, or grandpa or grandma. Celiac disease, gluten sensitivity can begin at any age. It is precipitated sometimes by a stressful event, and doesn't just begin the day you're born. Can occur at any age, and if you decide it's necessary to eat gluten-free, sometimes my banker, for example, 45-year-old woman, had swollen joints. I told her to go gluten-free or get the test done. She didn't get it done. Went to her rheumatologist, who ordered steroids. She developed aseptic necrosis of her hips, lost both her hips. And they came back to see her. I said, well, did you get the testing done? No. I've been gluten-free like you told me in the first place. Success story. All the other symptoms, goodbye. And we love you all. That's why I'm doing this. And because we care about you. Listen to our other shows, and you can go to Kachmann Health, as you see on there, about 300-400 TV shows you can watch for free, or see me at the Tri-River Pharmacy there by Concordia, Three-River Pharmacy by Concordia. I'll coach you for nothing. That's what I'm doing these days, besides giving these talks. And we thank Public Access TV for giving me this opportunity to speak to you today. I love you.